Hi, welcome. I have Karch Smith here, and um, Karch is a graduate of Brigham Young University, and he just completed his first year at the University of Utah's Med School. So, Karch, thanks so much for being willing to talk to me today. I just want to kind of learn more about your experience, and also, especially kind of now that the application is definitely kind of in the rearview mirror for you, and you've put a year under your belt of actual med school. I also want to learn kind of like as you look back on it, like what you think was so valuable versus what kind of worked and everything. Anyway, so we'll just get started talking. Um, so you finished up your first year amid COVID. How did that go?
It was really, really good actually. So my first semester, obviously we didn't have any issues with COVID. My second semester was divided into two units. The first half of the semester was titled Molecule Cells and Cancer. So it was kind of all about DNA, and it was all about chromosomes and cells, hematology, oncology, and some of the pharmacology that goes along with treating that. And so we were kind of in person for all of that. And then our second unit of the semester titled Host and Defense, which is basically immunology and microbiology, and then the pharmacology to treat some of those infections. We probably got through like 1 or 2 weeks in person for that unit, and then we completely switched to everything online. Luckily for that unit, it is very memorization heavy. For any pre-meds who have taken a microbiology course, they understand that there's a ton of things to memorize, and especially with if you add pharmacology to that, so all the drugs to treat it, there's a lot of memorization. So I think that type of learning is almost better suited just kind of personal, kind of online. So that actually worked out really well. The part that was a little tricky was we also have a clinical skills class and patient presentations where we all dress up in our white coats and a patient comes and they tell us their story. And those are really, really valuable. We're not allowed to take a laptop in there. We just go and we listen and we ask questions. So I missed out on that a little bit during COVID. And then our clinical skills class, it's kind of hard to learn how to do venipuncture, and learn how to do a skin exam online. So yeah, that part we're going to make up some of those clinical skills, hopefully come fall if we're able to be back into the swing of in person and everything. But aside from that, I actually really enjoyed kind of studying on my own and studying online. It was kind of nice.
So I guess my question, what's been your favorite thing about med school so far?
Whew. I have really, really enjoyed medical school. I think it's a lot more fun than undergrad. One of the reasons is because in undergrad, you kind of have your eggs in a lot of baskets to try to get into medical school. But once you're in, everyone's just in your corner. It's
Mm.
amazing. After every quiz and every test you take, the academic success office, we have a whole office devoted to your academic success. They will send you a report of how well you did, and they'll send you a report of what types of questions you're getting right and which ones you're struggling with. So if it's more of an analytical or if it's more of kind of a memorization question, and they have tutors and academic coaches set up to help you with that. And so everyone's just really in your corner. So that's really nice. We have a whole wellness program with massage chairs and yoga classes. And so it's really, really cool just having a ton of support.
So medical school is like a spa.
It really is. Yeah. Yeah.
So, um, okay. So now that really, I love kind of being able to hear your perspective now that you've completed a year, like you think back, and I guess the application process for you was 2 years ago, right? And
Uh-huh.
all of that. Um, what do you think, what activity did you participate in as an undergrad that you feel has been kind of the most valuable in med school for you? Is there anything that really stands out?
That's a really good question. To be honest, I would probably have to say for about 3 years in my undergrad, I drove up to Midvale every week from Provo, and I volunteered at a free clinic up there. And I volunteered with a general surgeon And I was basically interpreting for his patients. I was almost like a medical assistant. So I'd kind of measure their vital signs, take their history, and then I'd interpret for them in the office. And then I'd also help out in surgeries. And just the amount of exposure that I got, that just small surgeries, understanding sterile technique, understanding really a lot of clinical exams. For instance, this semester we learned the breast exam, but I had already seen it and the surgeon let me do it a couple times. And so I kind of knew what to do. Um, I would say that was definitely my most valuable experience. It kind of got me in the healthcare field. I got to use my Spanish, which was really fun for me. And then I got exposure to a lot of kind of really basic principles of medicine in more of a, I would say, less acute setting, right? They're at a free outpatient clinic, so I'm not in the hospital. It's not like someone's life is on the line, which also can be very, very valuable because you get a lot of experiences with, acute care. But I really thought that I learned a lot from those. I went for about 4 hours every week for 3 years.
Mm.
And there's a lot of things that just kind of got ingrained in me as I was there. That was very, very valuable.
I love that you said that because Karch sent me his medical school applications just in preparation for the interview. And so one thing that stuck out to me as I read through it is that you did such a good job of kind of telling or kind of putting together a package of why. Like you worked a lot with an autistic boy and you talked a lot about, and it wasn't necessarily that you're like every experience and activity was with that one boy, but I certainly saw a theme, or I saw like connections between your different activities and why they were important to you. So I love that you bring up that clinic, because that didn't even stand out to me as I looked through your application, because I saw so much of kind of that other stuff. How did you get involved in that clinic? I think that's one thing that students ask all the time is kind of like, well, how do I find these things? I'm like, how did that
Yeah.
work for you?
Honestly, that is one of the most hardest and most difficult parts about being a pre-med, is kind of finding opportunities. I got lucky. The surgeon was my step aunt's uncle, so kind of a very
Like
distant,
twice
weird
removed and
connection. Yeah. So basically, it's my mom's husband's sister-in-law's uncle. It's the weirdest connection ever. But I was over at their house and I was telling her that I was putting in applications at all these different free clinics around Utah for me to kind of be a Spanish interpreter. And she was like, "Oh, you should just go work for my uncle." And so she gave me his number and I called him, and it started with me shadowing him. So I went up there just to shadow him at the free clinic for a day. And I actually ended up interpreting for him almost the whole day. All of his patients are Spanish speaking. And a lot of times they'll have to wait for some of their rotating Spanish interpreters to come. And it ended up me just staying there. And I'd probably say I was, translating or interpreting for 80% of his patients that day. And he was like, "Can you come back next week?" And I was like, "I would love that." So it was almost serendipitous. I was at that time looking for an opportunity like that. There's a community clinic in South Provo I put my application in at. I put it in at another one in Provo. I had heard people talking about the Maliheh clinic, but I heard it was really crowded and kind of more like a rotation, like you couldn't just go every week. And so it was really serendipitous, but it just worked out really well. So,
one thing for anybody who's listening to these and has listened to a couple, I'll just kind of point out, like, I love that you said that, because as I'm talking to more and more students, the thing that I'm finding is that you have to just kind of talk about what you're looking for a little
yeah,
bit, and like, I would love it if every student who came into our office, I could say like, here's a list of all the places and you'll be a perfect match for this place. But you know, what I have also found is that I think med schools love to see students who encounter a problem and then what do they do to solve it. And this is one of those things that you're like,
true,
look, like, I'm willing to kind of like talk about it and start figuring that out. I mean, it's not ideal, but I
true.
think, I'm starting to see that more and more. So
It's a great point. It would be nicer as a pre-med student if you said, hey, I wanted to work as a Spanish interpreter during my undergrad years. And the pre-health office was like, here's a list of all the clinics you can do that at. But it's just, it's hard for that to even be possible because they might be capped on their Spanish interpreters at that time, and so I got really lucky. I will say sometimes in the pre-med years, you really have to, like you said, just kind of talk about what you're interested in with a lot of people. That one came about because I told my aunt at dinner at her house, and it worked out. And so
Mm-hmm.
I think, yeah, just talking about it with a lot of people and never giving up, just really trying to find what you're looking for, and you'll find opportunities.
Um, so tell me, what other kind of experiences do you think like were helpful for you as you went through kind of the application and interview process and now as a med student? Certainly like clinical experience, you're like, yeah, that was
Yeah,
valuable.
yeah.
But,
Um, so when I returned home from my mission in 2015, I served in New York City. Um, I was kind of trying to decide if med school was still the route I wanted to do. I was trying to keep an open mind. I had always known from when I was little, but I decided on my mission that I would really try and consider everything. And during that time, I spent some time with my cousin who has autism,
mm,
and I just really enjoyed it. And that kind of from there, it sprung to me being a respite provider for a family kind of in their community. They had a children with autism who was 15 years old. And so I was just providing respite. So I'd go there and play with the kid for, 8 hours a week. And that turned into me, I almost feel like it was an intellectual curiosity. That's the best way I could describe it. I loved spending time with him, and I was just fascinated by how his mind worked and how this disease pathology worked on the brain. And so from there, it prompted me to want to be a behavior therapist who comes to the house and can help
mm,
treat some of these behaviors that people with autism have. So that's what I did. I got certified and I became a behavior therapist. And then from there, I took it a step further and I found people who research autism at BYU, and I found two different professors. And so I started working with them in both their labs. One of them was a social skills group. So we were testing if you could teach autistic individuals social skills online and see if that would be just as effective as doing it in person.
mm,
Because there's a number of individuals who are diagnosed with autism spectrum disorder, but they might live in rural Utah. And so they don't have, the same access to care that others do in a more urban, Salt Lake or even Provo. They don't have access to therapists. And so we were testing that. And then in the other lab, we were looking at what autism looks like under fear, what it looks like in an fMRI scanner, and what their
mm,
amygdala does. So that was cool. That was kind of more physiological and anatomical. And so I think that came up a lot in my med school interviews. And I think it was because it was something that had to do with helping individuals who suffer from a certain disease pathology, and it was an intellectual curiosity for me. It wasn't something that I was just like, okay, I'm going to go check this box,
mhm.
help out this family for 8 hours a week, and I'll put that on my application. But I wasn't thinking about that. I was like, I really want to understand what's going on here a little bit more. And that led to another thing, me becoming a therapist. And then that led to me being a researcher in two different labs, kind of studying two different sides, kind of the social side and the more physiological aspect of autism. So I really enjoyed that. It was really cool kind of being able to tell people like, oh yeah, like I know this thing. Like I've been looking at this for, 3 years. I could tell you about autism. So that was really fun, and it came up a lot in my interviews.
Yeah. I honestly, I can see why, just because I saw it. So I use the idea of the red thread and just kind of like you want to link your stuff together for
Mm-hmm.
for the admissions committee to kind of be able to see what you're interested in. So I saw that so well in your application. Like I really did.
Thank you.
That's not me being even complimentary. It was just like really on it. I was like, oh, so good. Um, so how come you decided to go to the U?
Great question. So I applied to around 28 or close to 30 schools. I sent secondaries back to, I think, only 23 of them.
Mm-hmm.
And I was granted 7 interviews. So I had an interview I applied to one DO school. It was the one for free that you could apply to on the TMD SAS application, the Texas app.
Mm-hmm.
So I got an interview there. That's University of North Texas. I got an interview at George Washington, the U, Penn State, VCU, Albany, and Creighton. And I interviewed at all but Albany and Creighton. Their interviews came after I had gotten accepted to the U. To be honest, during my application process, I got the best vibe from Penn State. I liked their school better than other schools. I just felt like they were incredible. They had this very large academic center. Within like a certain, mile radius, they had all these trauma cases that were getting filtered into their hospital system. They had a ton of research opportunities, and everyone seemed like they really cared about me. I stayed with one of the med students there, and on my interview, both the interviewers had read my entire application. And so I just thought that was so cool, because when I got in there, they were like, "Oh my gosh, Karch, I'm so excited to have you here. Like, I read through your entire application. I have so many things I want to talk to you about."
Mm-hmm.
And I was like, "Whoa, this is cool." Before, everyone's just kind of like sitting back like this, folding their arms, staring me down, but they just showed that they really cared about me. So that was really cool. When it came down to it, for me, it was between Penn State. So I got accepted to VCU, University of Utah, University of North Texas, Penn State, and then I was on George Washington's wait list. And when it came down, I actually ended up getting a scholarship from Penn State that was equivalent to $25,000. So it was half scholarship. I think their tuition's $50,000 a year, and so they're going to give me 25. When it came down to it, I really wanted to see, to be honest, I kind of told my wife, I'm going to try and get into as many programs as I can, but I'm going to let you make the final call, because I'm pursuing my dream and I don't want it to be at the expense of, where you want to live and everything. And when it came down to it, to be honest, my wife got an incredible job up at the University of Utah Hospital. And so then we were kind of more leaning towards Penn State. But once she got that job, if your spouse works at the University of Utah for a year, then her husband, so me, could get half tuition for the remaining years. And so basically it kind of would have almost evened out as far as tuition goes with them in Penn State. And looking at the opportunities that the University of Utah had, so their hospital has been ranked top 10 in the nation for the past 10 years. Everyone's really prideful about it. They wear these vests and it says top 10 for 10 on their embroidered on their vest.
And they're in the Pac-10, so it's just
they're in the
full
Pac.
circle.
Yeah.
Full circle.
So I really wanted to go to a place with a really strong hospital. And you might think that, if it's a good med school, they should have a good hospital. Sometimes it's not always the case. And the University of Utah is an institution where they have a really, really strong hospital with a lot of fellowship opportunities. So for instance, if you wanted to do something really niche, like Mohs surgery, which is a subspecialty off of dermatology, which there's not a lot of programs in the nation, but the University of Utah has it, right? Or if
My
you
cousin just had that, so I'm like nodding.
Really?
Yeah, like
Yeah.
It's totally crazy, but I'm like, oh yeah, I know all about that.
Yeah.
Mhm.
And honestly, most kind of niche specialties like that, these like very fine subspecialties with these fellowship programs, the University of Utah almost has a program for all of them. And so I thought that was cool, because if they usually have a fellowship program, they usually have research opportunities in that area. And research is really good in medical school, because that and kind of your board scores are kind of like the two big factors of what can get you into a certain specialty. And so that kind of sealed it for me. I saw the strength of the hospital, and my wife is going to have a really good job there. And I was like, okay, let's do it. This seems like it'll be a really good place. And I'm really glad. It's been amazing.
That's awesome. So do you know what you would like to specialize in? I mean, it's still kind of early, but I guess you start thinking
Yeah.
about it. I know. So,
Yeah. I kind of, when I was really little, I thought it was 100% I'm going to do orthopedics. Um, my dad was a professional athlete, and growing up, we were just always involved in sports, and it was just kind of, what I thought would be the most natural fit for me. I liked sports medicine, and it just seemed really like an easy fit. But when I started doing a lot of work with individuals with autism in my undergrad and kind of got more involved with psychology, I shadowed a bunch of child psychiatrists, and
mm,
I started really, really loving that. I think I do want to do something with pediatrics. I love kids.
mm,
And those are usually my favorite doctors. Not to say all doctors aren't great, but the pediatricians and the pediatric subspecialists, they're always so cool. And that's kind of my culture. They're really, really nice. So I think I'll do something peds. I'm not sure what it will be. I still like orthopedics. I also really like, child psychiatry. I also really like ER. Shadowing in the ER has been really fun. So I'm kind of all over the map. I've even actually considered reproductive endocrinology and infertility.
mm,
So that's like if you've heard of IVF and
mm-hmm.
stuff like that, those are those doctors. So I'm kind of all over the map, but I don't know. Hopefully I'll figure it out.
I mean, like, it's all interesting right now. So,
Yeah, exactly.
um, okay. So I guess, like, what would you tell if you could go back and kind of tell, like, someone who's just kind of entering college and saying, okay, I want to go to med school, like, what advice would you give them? And then, like, as a follow-up, what advice would you give to the person who's applying right now? So we'll start with kind of like the freshman. Like, what would you tell them as they get started in their undergrad?
It's a great question. I wish someone told me about this when I was a freshman. But when I was a sophomore, when I got home from my mission, I was introduced to this book called How to Be Pre-Med.
Mm,
And it's written by a Harvard pre-health advisor, pre-med advisor. And it basically lays out very plainly what you need to do to get accepted to medical school. And that, I think, was the most helpful thing I had ever read in preparation for medical school. So right off the bat, as far as resources go, I would recommend, and that's what I say to everyone who asks me, I'll send them that book on Amazon. I'll say, buy this right now, read the whole thing. You can read it in a day. Read the whole thing, take notes, and decide how you want to kind of mold your story.
mm,
The book kind of goes into these like 9 different pillars that you need to fill. They call them buckets, or maybe it's 6 buckets. I think it's 6. I can't remember. But she basically says you need to fill these 6 different buckets to get into medical school. And you also need to have a story. And those things really, really helped me because um, I don't think that you can just kind of copy what your friends are doing, and you see your friend get involved in a lab, and then you see your friend volunteer with Anatomy Academy, and then you see your
mm.
friend take these OChem classes and stuff. I don't think you can get into medical school if you just kind of copy what your friends are doing, to be honest. I think it has to be a little bit more deliberate than that. I think
I'll
you have,
say it, thoughtful,
yeah,
right?
exactly.
Like, just you got to be thoughtful about why you're
Exactly.
doing this. So,
Exactly. And in that book, she basically says you should think of a phrase that describes who you are and why you want to go into medicine, and then mold your application off of all of that.
mm,
And that's really good because if someone says to you in an elevator, why do you want to be a doctor? You should, as a pre-med, you should have, it might change over time, but you should have a 1 sentence thing that you can respond to that person with, hopefully part of your identity. Because a lot of people who apply will say, I was diagnosed with lung QT as a kid. I've had a pacemaker since I was 12. I want to be a pediatric cardiologist to help people with heart problems, right?
mm-hmm.
People have those stories. Not everyone does. I definitely didn't have any medical stuff growing up like that. But I think it's really good to understand why you really want to be a doctor. So kind of do some self introspection. And then medical school admissions committees love if you do something that you're interested in and passionate about. And so once you figure out what in your identity really resonates with medicine, then kind of mold all of your activities and mold your story to fit this common theme of why you want to be a doctor. So if you can kind of have that one liner in your head as you do these activities and as you decide to get involved in these certain things, then that'll really, really help you throughout your all 4 years. I started late. I wish I started a semester and a half earlier than I did. I just didn't know. I didn't know about that resource and I didn't know what to do. So
I love that because I have seen that just as I've tried to help students. It's so much easier to help the student who was thoughtful right from the beginning, as opposed to, okay, I've done all my stuff, help me figure it out. I'm like, oh,
exactly, yeah,
okay, we'll brainstorm together. We'll try.
exactly. I would
Mhm.
say it's much harder to come up with a reason for why you want to be a doctor and a story that goes along with that, with someone who's just kind of checked boxes throughout all 4 years. And it's a lot easier for someone who from freshman year said, hey, I'm really, really interested in diabetes. My grandpa had diabetes and died from heart failure, and this is something I just want to really figure out what's going on. So they volunteer at a free clinic of people with hypertension, diabetes. They start researching diabetes. I know there's some people at UofU who do research diabetes, and all their kind of activities follow that. It just looks really good, and I think you'll have more fun doing something that you're interested in.
That's always the hope, right? Like if you're
Yeah,
actually interested in it, you might enjoy it.
exactly.
Okay, so that's for the kind of like the undergrad, like the just starting out. So what would you tell the person? I mean, oh, they're like junk. I wish I would have read that book, but now I'm applying. Like
Yeah.
what would you tell that person who's applying right now?
Um, for the person applying right now, I would say um, kind of going along with that, if you kind of, let's say you didn't really kind of plan all that from the beginning, but here you are and you're applying. I would still take some time to do some introspection and figure out your reasoning for why you want to be a doctor. And hopefully that's come out in your personal statement. Um, and then I would be very deliberate in the schools that you apply to. Some schools have very specific missions, right? For instance, Loma Linda in California, their mission is about, right, helping others in the way that Christ healed others during his reign and ministry on the earth. And so if you're not a very religious person, then it may be hard to apply to that school because that's their mission, right? So I'd really be deliberate in the schools that you applied to. When I applied, I probably went through every single school on MSAR and I created this big Excel doc and I listed out everything about them. I listed out their average MCAT. I listed even down to what the area looked like of where I could potentially live in, right?
Mm.
And especially list their mission and see if their mission kind of aligns with yours. Some of the missions of the school you might see are very, very similar, something related to patient care, education, and research. But there's other ones that are a little bit more specific that specifically mention helping underserved populations. And for me, that was what I was really interested in. I really was interested in helping individuals with developmental disabilities or helping individuals who were kind of more underserved under the federal poverty line. And so I really liked schools that mentioned that. And I saw that they had community service within their curriculum. For instance, that was George Washington. They're very much about helping the underserved. And so you can see on their website that they had lots of free clinic opportunities. And so for someone applying right now, I wouldn't just throw a bunch of schools on a list and cast like this big wide net and hope something lands. I would really be deliberate about it and really look up everything about them so that when you're writing your secondary and they ask the question, why our school, you have a very, very good answer for them. And you can say, I just love that you believe in ABC. And that aligns with me because of this part of my identity and this part of my passion. The more you can do that, schools really, really like that, because then when it comes to the time where, let's say you interview and you haven't heard back from them, you can then send them another update letter if they allow it, right?
Hmm.
and remind them and even inform them on activities that you've continued to do that maybe aligns with their mission and their goals. So I'd say that really, really helps you a lot. And they really want people who want to go to their school. A lot of people have really good grades and a lot of people are really good applicants, but they do give preference to people who deliberately send them, a letter of intent or an update letter, and they say, I really, really want to go to your school.
I always say it's kind of like courting a little bit. Like you kind of have
It
to
really
woo
is,
them
yeah.
a little. Like I wish I had a better kind of metaphor for it, but I'm like, no, it's just like, hey, still here, still really interested in you.
Exactly, yeah. Yeah, that's a
Yeah,
great point.
yeah. So, okay. So, is there anything else you'd like to share with the pre-meds that are listening to this?
Um, I would say also they can feel free to reach out to me whenever they want. You can give them my email. But also, some of the people that were very, very influential for me were people who were 1 or 2 years ahead of me in the process. Um, I always found that even just taking pre-med classes at BYU, how to study for them, how to do prep for this, people who did that a year ahead of me or 2 years ahead of me, they were so helpful for that and setting up my schedule and everything. Because you can read a ton of books. I bought 2 books that taught me how to get into medical school, right? And I just devoured them. I went through and highlighted everything and figured out a plan. But that being said, it's not tailored to my BYU plan, right? And my
Mm-hmm.
BYU schedule and my major for that matter. And so, especially if you're early on, find someone who's, a year or two ahead of you who has kind of seemed like they have it together as far as figuring out how to get into medical school, or someone who just got accepted and really figure out what they would do differently or figure out how they would study for classes, how they would set up their schedule, how they would go about getting opportunities, because that really helped me a lot. Just by doing that, I was able to land some leadership opportunities just by networking with, people who were a couple or years ahead of me. And then also it helped me really set up my schedule and really understand kind of the more nuanced questions of how to apply and how to balance everything. You have to do so much
Mm-hmm.
research, leadership, community service, get really good grades, right? It's really, really hard to balance it all. And so reaching out to those people ahead of you for support is really, really good. And also seriously tell them they can email me whenever they want.
I love that. Thank you. And so I'll just kind of reiterate, like it kind of goes back to the idea that you're like, I started talking about it. I started talking about it with people so that I could kind of learn from them, like and kind of how did they
Exactly.
do it? So anyway, well, thank you so much, Karch. We'll get this posted.
Awesome. Thanks for having me.